Welcome again to my YouTube channel where I talk about different nuggets. Today I'm going to talk about a psychological disorder called the Munchausen syndrome. This is a psychological disorder where some people fake illness for the sole purpose of getting attention. Now, these individuals pretend to be sick deliberately, and their illness is in such a way that you cannot be able to diagnose it, even when you take them to hospital, because in any case, it's fake. It's actually not an illness. It's very deliberate in order to get attention. For example, they'll say they have a splitting migraine, and they always do. Or they say their eyes are not okay. Or they will say they have, they don't say things like colds, because having a cold or a flu is kind of easy to diagnose. So the symptoms will have to be things like headaches or dramatic events or dramatic illnesses that cannot easily be diagnosed, because the idea is to get attention. Now, when you ask this person to go and rest, they do not want to rest. Because you see, when they go to their room and rest alone, then it beats the purpose of getting sick. So you'll tell them, please just go and lie down. And they'll say, no, it's okay, let me stay here. But then even as they stay there, they'll keep groaning and moaning, so that you keep asking them, are you okay? Can we take you to hospital? Is everything all right? And these people can be very annoying, especially when you do not realize what is going on. They lie about symptoms. They can even faint. In any case, how do you prove they have fainted? And as they faint, in their fainting state, you give them the attention that they want. Remember, they have not fainted, they are conscious, so you give them the attention they want. They are sober, they even tamper with blood samples. These are the kind of people who will put blood in their urine, so that when it is taken to the lab, they will take it to the lab. Of course, it has blood. So they will give the doctors the run around, yet they actually knew what they have done. These are the people who will poison themselves. They will take something bad that has bacteria. They will take dirty water so that they can be unwell and go to hospital and get sick. These are the individuals who will cut themselves. And guess what? When the wound starts healing, they will actually tamper with the wound so that they will reopen it, so that it gets reinfected and they go to hospital because they need the attention. They love frequenting hospital. And they go to different hospitals because, of course, if they are consistent with one hospital, the medics will already know this is Munchausen syndrome. So they keep going to different hospitals because for them, the idea is to get the attention. Incidentally, these people have very good medical knowledge. They study. They will challenge the doctors. They study, so they know they know that the diagnosis that they want to be prescribed. They also willing to go through very painful procedures. These are individuals who are actually even willing to go through an operation if possible. Unfortunately, or fortunately, for you to go through an operation, medics have to do tests. So they never succeed much on operations because nothing warrants for them to go through operations. However, they are willing to go through painful procedures like blood samples. If you're like me who is scared of needles, I wouldn't go through the pain of you having to stick a needle in me just because I need attention. But they are willing to go through such painful procedures. They report vague, inconsistent diseases, so to speak. Lately, there has been a new development, because they are those ones that we are calling Munchausen syndrome by internet. These are people who have the Munchausen syndrome, but what they do, they get into internet and they join a certain group that is discussing or who are suffering a certain disease, for example, cancer or whatever, and they are going to join that group and pretend to also suffer from cancer, so that yet again they get sympathy from the group members who are genuinely cancer patients. That one we call Munchausen syndrome by internet. Now, there is another syndrome called the Munchausen syndrome by proxy. This is where an individual maximizes on another person's illness so that they get attention, so that this individual gets attention, especially some who are caretakers. They are taking care of their kids, so they will masquerade and pretend that their child is sick so that they, the caretaker, gets attention. Or some are taking care of older people, like older parents, or you're taking care of your grandmother. So you will keep faking that your grandmother is unwell so that you get the attention. Some of these people will give children medicine that will make them diarrhea or will make them throw up, so that they have reason to go to hospital and say the child is throwing up. That's why we are here. And of course, they get attention. Well, through the patient. That's why we are saying they get attention by proxy. Some go to the extent of hitting thermometers so that the patient looks like they had a fever. And that's why we are here in hospital. Others will underfeed the patient, the child, or the older person, so that they are going through nutritional crisis and they look sick. Hence the reason why, you guessed right, I am bringing them to hospital. They will rush these people to hospital for every small thing. Their baby coughs, they go to hospital. Their baby sneezes, they go to hospital. Even when you know what to do, you still want to take them to hospital. At the slightest mention of a headache from the patient in quotes, because they may really not be sick, you take them to hospital. Now, what happens is also this person who has a Munchausen syndrome by proxy, they are overly involved in the medical process. They want to know every bit of it. Not because they care, but because they masquerade also as medics. These are the people you will visit their patient and they'll go on and on and on, trying to show you how they know the medical procedure, they understand the medications. These are the people who will actually challenge the doctor. I don't know if you go to, if you've ever met someone who is either sick or they have someone who is sick, either a child or a parent, and they'll keep telling you about that illness. They'll tell you the diagnosis, they'll tell you the medication, they'll tell you what they did about it, and you actually start thinking, am I talking to a doctor here? Not that they are right, by the way, but they just thrive on that attention. And these are people who really irritate the medics, because they will tell them this is not the right medication, this is not the right procedure, I don't think this should happen, I'm going to take them to another hospital. And when they take them to the hospital, instead of allowing the medics to do their due diligence, they are the ones explaining. These are the kind of people where they take a patient to hospital and the doctor wants a little privacy to question the patient about a few things, even if it's a child who is able to express themselves or an mature older person. They insist on being there. They refuse to leave. And guess what? You guessed right. They are the ones who answer the questions for the patient. That is Munchausen syndrome by proxy. It is actually a psychological disorder. You are wondering, so what? What is the solution? The solution is for this person to seek therapy. Of course, we are hoping that they understand they have a disorder so that they seek therapy. It's always good also, if they accept they have a disorder, to have a family therapy, so that even the family understands what is going on and they are able to help their patient. Thank you for watching. Again, let's keep it real.